Thank you. Thank you. Let me first start by introducing myself. My name is Jose, and I'm a nursing student at Aspen University. In this assignment, we had to create a 10 or 15-minute TED Talk style presentation that summarizes a clinical problem, we propose a change, and the research on the topic that I selected. Pressure ulcers on patients are a serious problem. Pediatric patients have increased chances of developing pressure sores due to compromised perfusion, immature skin, fluid retention, altered neurological responsiveness, medical devices, moisture, and decreased mobility. According to Vischer, pressure sores are often classified according to severity and depth. In stage 1, the skin is non-blanched, inflamed, and occasionally softer, warmer, and more painful than the surrounding tissues. Partial dermal loss, such as intact blister or shallow open ulcers, characterizes the second stage. Stage 3, on the other hand, entails the detention of dermal loss in subdermal components. In the fourth stage, tendons or muscles are revealed along with the loss of full thickness tissue. At New Life Regenerative Children's Center, the majority of pressure sore cases are discovered at threatened in the fourth stage, or when the full thickness lesions are converted with scar tissue or peeling. Pressure ulcers have a detrimental effect on a person's health, quality of life because they cause constant terrible pain, poor mental health, despair, and negative self-perceptions. Regardless of the requirement for strict adherence to evidence-based treatments, including repositioning, nutrition, skin care, and pressure sore risk assessment, the law emphasizes that the crucial part nurses play in helping patients with pressure sores talk about the problems that pressure sores cause and emphasize that the occurrence of these lesions is an indication of poor medical care. Pressure area care is a crucial component of nursing practice and routine. Best care procedures lay the foundation for avoiding needless suffering. Every nurse's primary responsibility is to prevent skin problems and preserve the integrity of the skin by identifying at-risk patients and developing a preventative strategy. In order to reduce the gowning number of pressure sores at the nurses must regulate through the skin exams and establish the necessary treatment procedures. On the first day of each week, the nurses will do a head-to-toe skin evaluations in patients, searching, compromise, and inspecting any pressure sores at the stage. Operationalizing the change. A common vision must be created in order to switch to the weekly comprehensive skin checks. According to Gemsey and Wiseman, a change proposed should align with or relate to the current practice direction. A shared vision, in the opinion of Gemsey and Wiseman, requires communication the vision to every team member in order to promote and adapt culture. The nursing staff will inform of the target statement to reduce the rate of pressure ulcers in pediatric and in intensive care units. The course of this issuing your inadequate, specific, time-bound, achievable, and pertinent manner. Training and providing support services will be the next stage in implementing the process. Training on the requirements for the new practice and ongoing support, which includes assistance from other team members, safe spaces for discussing both positive and negative experiences with the new practice, management support, and access to resources. Inspire, confident, and encourage team members to embrace the change. The nursing team will get ongoing data collecting, skin assessment, and pressure ulcer anatomy training for quality improvement specialists. Additionally, the outcome manager will have continuous telephone and in-person meetings to get input from the nursing team about their experience and perspectives and make any requirement revisions. During staff meetings, the nurses' questions, worries, comments, and clarifications will be welcome. Additionally, a team culture will be promoted according to understanding a practice change requires creative and a team culture where each person works toward a common objective. Assigning responsibilities and establishing clear expectations are key components in fostering a new team culture. Theoretical model and overcoming barriers. We'll use Rogers' notion of invention transmission. According to the concept, adopting a behavior, an idea, or an invention does not necessarily happen immediately within the social system. Rather, it entails process which in some people are quick to accept the idea. These people are categorized by Rogers under different change-accepting subgroups. He calls innovators those who are passionate about change and constantly provide solutions. He refers to those who is sized for change and embrace leadership in roles and early adopters. The early majority, on the other hand, consists of people who are open to ideas but dislike taking leadership responsibilities. While laggards actively opposed to change, the late majority is doubtful about it. According to this fusion of innovations model, key factors is the decision-making process for innovations include persuasion, knowledge, execution, choices, and confirmation. These actions will aid in overcoming numerous obstacles and assist shape to acceptance of evidence-based practice. Developing awareness of the concept of skin assessment is part of the knowledge stage. As previously noted, the nursing staff will get trained on the philosophy of pressure, sores, and skin examinations. The group will start formulating components of the proposed weekly throughout skin exams. The selection of change champions, certain team members with outstanding leadership abilities who can persuade and encourage their colleagues to embrace the concept will be necessary to address the negative perceptions. As change champions, the innovators and early adopters will persuade other groups to accept the weekly skin evaluations. Strategies can impact acceptance or rejections at the decision-making stage. Additionally, people search for more details about the concept at this phase. The acceptability will be improved with the aid of training and change champions. Additionally, a demonstration of how weekly comprehensive evaluations and meetings can improve health outcomes and increase the efficiency of the nurses that will provide it. An evaluation of the effort will also be conducted every 3 months to weigh in benefits and drawbacks. Sources, evidence for improvement. The patient's pressure ulcers information is the data source that will be used to gauge the improvement in outcomes. Ethical considerations. Data gathering will need informed consent, which is a prerequisite for ethics cannot be ignored. Before evaluations and data gathering may begin, a consent document must be signed by both parents and the child, and an institutional review board will work closely together. Evaluating the outcomes. The collected patient data will be used to evaluate the outcomes. Comparisons will be made between the proportion of patients who experience pressure sores both at the start of treatment and at least 3 months afterwards. If the initial number is decreased by 70%, the goal will have been accomplished. A decrease in the percentage of patients with pressure sores in later phases will also signal progress. Disseminating findings. After results examination, the results will be presented at the nursing event. The results will also be posted on the New Life Regenerative Children's Hospital website. And this concludes my presentation, and I hope you find my video helpful and educational. Thanks for watching.